Assalamu alaikum. Our lecture today is maxillary sinus. Paranasal sinuses. The sinuses are the air spaces within the pneumatic bone situated at the frontabasal region of the skull. They open into the nasal cavity through their lateral walls. Maxillary sinus are the largest sinuses among the other paranasal sinuses, which are frontal sinus, sphenoidal sinus, and ethmoidal sinus. This is the maxillary sinus location. This shows the location of the paranasal sinuses, which are the frontal sinus. Red one is the ethmoidal sinus or cells, and the orange is the sphenoidal sinus, and the green one is the maxillary sinus, which is the largest one. Maxillary sinus and its development. The maxillary sinus is the largest paranasal sinus. It lies inferior to the eyes in the maxillary bone. It is the first sinus to develop and is filled with fluid at birth. It developed at about 4 months of intrauterine life. The earliest phase of pneumatization is directed horizontally and posteriorly, whereas the later phase proceeds inferiorly toward the maxillary teeth. The maxillary sinus developed follows a number of morphogenic events, which include the horizontal shift of the palatal shells occurs. These shells then fuse with each other, and the oral cavity gets separated from the nasal chamber or cavity. Second, expansion of the lateral nasal wall, which starts folding, and 3 nasal concha and 3 nasal meatus arises. Third, the superior and the inferior meatus remain as shallow depression along the lateral nasal wall. The middle meatus expanded into the lateral nasal wall and grows inferiorly to occupy the maximum space of the future sinus. Fourth, the sinus appears and grows vertically. It expands and modifies in form, and it reaches its final height after the eruption of all permanent teeth at about 18 years old. 8 changes in the development of maxillary sinus. It looks like tubular at birth, ovoid in childhood, and pyramidal in shape in adulthood. The structures of the maxillary sinus. The maxillary sinus is a 4-sided pyramidal cavity which is present in the maxillary body. Its walls are thin, and these correspond to the orbital, alveolar, anterior, and infratemporal aspect of the body of the bone. Its apex directed laterally and extend into the zygomatic process. Its base face medially, which form the lateral wall of the nasal cavity. The base of the sinus is the thinnest of the all walls of the maxillary sinus, and it presents a perforation at the level of the middle nasal meatus. This is called ostium. The floor of the sinus is formed by the alveolar process of the maxilla. The roof is formed by the orbital floor. This picture shows the skull this is the location of the maxillary sinus, and this is the pyramidal shape maxillary sinus. This is the apex, and this is the base, and this is the superior wall, and this is the inferior wall, and this is the anterior wall, and from here is the posterior wall. This is the apex toward the zygomatic wall, and this is the base, which is located in the lateral wall of the nasal cavity, and this is the superior wall located toward the orbit, and this is the inferior toward the maxillary bone, and this is the anterior wall represent the facial bone. The four-sided are related to the surface of the maxilla as follows: anterior side to the facial surface of the body, inferior to the alveolar and zygomatic process, superior to the orbital surface, posterior to the infratemporal surface. This is the maxillary sinus, and this is the meatus. This is the opening of the maxillary sinus toward the nasal cavity, and this is the concha of the inside the nasal cavity. The histological features of maxillary sinus: the space of the maxillary sinus is surrounded by three layers, which include the epithelial layer. The epithelium is pseudostratified, columnar, and ciliated, derived from the olfactory epithelium of the middle nasal meatus. The columnar ciliated cells are the most numerous cell type in maxillary sinus epithelium. Other cells are basal cell, columnar, non-ciliated cells, and secretory goblet cells, which produce mucus. Second is the basal lamina, which separated the epithelium from the subepithelial layer. The subepithelial layer include the periosteum. This layer contains subepithelial gland, consists of acini with two types of secretory cells, include serous and mucus cells. They secrete mixed secretory product. This is the histological pictures of the wall of the maxillary sinus. This is the epithelium layer, which include the ciliated cell mucus transport. And this is the goblet cells of mucus production, and this is the basal lamina, and this is the subepithelial layer, which include connective tissue. The function of maxillary sinus or paranasal sinus: first, decreasing the relative weight of the front of the skull, and especially the bone of the face. Second, increasing resonance of the voice. Third, providing a buffer against a blow to the face. Fourth, insulting sensitivity structure like dental root and eye from rapid temperature fluctuation in the nasal cavity. Other function is humidifying and heating of inhaled air because of slow air turnover in this region. Other function is regulation of intranasal and serum gas pressure. Also, immunological defense by production of bactericidal lysosome to the nasal cavity. Clinical consideration: first, the base of the sinus is separated from the apices of maxillary, molar, and premolar teeth by a thin bone, or sometimes there may be no bone in between maxillary sinus and the apex of these teeth. So surgical manipulation of these teeth often results in an oronasal fistula if there is extraction. During extraction, if the apex of these teeth fracture, may be present inside the maxillary sinus and there is oronasal fistula. Second, presence of molar or premolar radicular cyst, hypercementosis, abscess, or granuloma may also result in oronasal fistula between the maxillary sinus and the oral cavity. Third, agnesis or complete absence, or aplasia and hyperplasia, altered development and underdevelopment of the maxillary sinus. Fourth, inflammation of the sinus is known as sinusitis. It causes headache with thick, purulent, persistent discharge from the nose or from the opening of the maxillary sinus, which is near the middle meatus. Radiographic appearance of the maxillary sinus by intraoral periapical radiograph in this picture and this picture. In this radiograph, the root of the maxillary teeth may appear to project directly into the sinus and may produce conical elevation on the floor of the sinus, yet there is always a layer of bone and mucus covering this root. This periapical radiograph shows this root of the upper molar and premolar teeth, and this pointer represents the line or the wall of the maxillary sinus, which separated these apex from the maxillary sinus, and this yellow line represents the wall of the maxillary sinus, and this is the root maybe shows present inside this maxillary sinus, but there is a wall of this sinus present here. Another radiographic picture for showing the maxillary sinus is by the panoramic view or orthopantomography view or OPG. This view gives a good display of lower aspect of the antrum. This is the lower aspect of the antrum, shows the wall of the maxillary sinus or antrum, and the pointer represents toward the wall, which separated of the maxillary sinus from the apex of the maxillary posterior teeth. So that's all for this lecture, and thank you for listening. Goodbye.